Peace. Welcome, YouTube, to the live book reading of Clinical Application of Respiratory Care. I'm your moderator and narrator, Uriel Riley. Honor and love to all my family and friends. Yesterday we celebrated the homegoing of Cornelia Bennett Mays, my great aunt. I love you. It was great to see all the family there. Aunt Linda, Uncle Wilbur, Uncle Marvin, and shouts out to Aunt Kim Calloway. Happy solar return. Love you so much, Aunt Kim. So, we pick up page 43. Histology, figure 2-9. The conduits are composed of from one layer to many layers of tissue, depending upon the location of the vessel within the circulation. All vessels have an endothelial lining, which consists of a single layer of flattened cells, providing a smooth inner surface. This is the only layer of the capillaries, and it is capable of selective permeability to substances such as water, electrolytes, sugars, and gases. Elastic fibers are found in all vessels except the capillaries. These elastic fibers form a layer just under the endothelial lining and resist the distending force of the intraluminal pressure, producing a tension within the vessel wall. Collagen fibers are found primarily in the arterial system. They also produce a tension in the vessel wall, but are stiff, rigid, and resist stress many times that of the elastic fibers. A circumferential layer of smooth muscle that can produce active tension is found in the arterial system. This smooth muscle layer is under the control of the sympathetic nervous system. There are both alpha and beta receptors on these muscle cells. Stimulation of the alpha receptors causes vascular constriction. Stimulation of the beta receptors causes vascular dilation. The tension produced by the smooth muscle layer in the arterial system is referred to as a vasomotor tone. A similar phenomenon is present to a lesser degree in the venous system and is termed venomotor tone. The maintenance of proper blood vessel tone is dependent upon the degree of tension developed by the elastic and collagen fibers within the vessel wall and the degree of active smooth muscle tone in the vessel. Peace, highest heart love. Thank you for being here. Happy Sunday. Thank you for the likes and subscribes and reading books here on YouTube. We are reading Clinical Application of Respiratory Care. So if any of you are looking to take the MCAT, this is the perfect reading for you. This prepares you for it. So moving on to page 44 is figure 2-9. Here we go. For all those taking notes and in the playlist. It has the artery, the arteriole, the capillary, the venule, and the vein. Thank you so much for being here. The second edition is what we're reading, Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Written for those taking the MCAT. Arterial blood pressure. This is very key. This is a big pin drop right here, okay? So let's take our time. Thank you so much for the likes and subs. Highest heart love, Travis. Arterial blood pressure. Thank you for reading with us. We're in the second chapter, Cardiovascular Anatomy and Physiology, a master level book because this is the channel you come to learn from masters. The right and left ventricles supply the energy to push blood through the conduit system. There is a progressive loss of energy as blood flows through the circulating vessels. The factor that causes this loss of energy is frictional resistance between blood and the vessel walls. This is demonstrated by a progressive drop in pressure. Therefore, in order for blood to flow through the vascular system and back to the heart, an adequate force must be developed driving pressure. Without an adequate driving pressure, the frictional resistance of the system would not be overcome and circulation would cease. A significant factor determining frictional resistance through a given length of vessels is the radius of the vessel. According to Pasquale's law, if we decrease the radius by one half, we will increase the resistance to flow through that vessel by a factor of 16. The resistance increases by the fourth power of the radius. Ding! The physical law of hydrostatics must be appreciated to understand the concept of blood pressure. Pascal's first law of hydrostatics states that at every point in a fluid system, there is a force which acts equally in all directions. This force is known as hydrostatic pressure. Pascal's second law of hydrostatics states that the pressure is the same at all points at the same level. His third law states that all fluids are affected by gravity. The pressure increases with depth and decreases with height above a known reference point. These relationships are extremely important in clinical practice since changes in posture will affect the blood pressure. Ding! Will affect the blood pressure measurements as since changes in posture will affect the blood pressure measurements as related to predetermined reference points. This becomes even more important when the blood pressure measurements are assumed to estimate the blood flow. As shown in Figure 210, when a patient lies in a supine, flat position, the middle cerebral artery, aortic root, and dorsalis pedis artery will be at the same level. The pressure at the aortic root is illustrated as being 100 millimeters Hg, and the blood pressure at both the middle cerebral artery and the dorsalis pedis artery is 90 millimeters Hg. The drop in blood pressure is due to frictional resistance. There is no gravitation difference. When the patient is placed in a sitting position, the vascular reflexes causes changes in vascular tone. This allows the same distribution of blood flow as in the supine position. The pressure at the aortic root remains 100 mm Hg. However, the middle cerebral artery pressure is 70 mmHg. This represents a real drop of 10 millimeters Hg as a result of frictional resistance and 20 millimeters Hg because of gravity. The dorsalis pedis pressure is higher than that at the aortic root. It lies 70 centimeters below the reference point and therefore has a 70 millimeter Hg gain in measured lateral wall pressure because of gravity. At a 10 millimeter Hg loss in pressure caused by frictional resistance results in a pressure of 160 mmHg. So here's figure 210. We're at the top of page 46 in the second chapter, Cardiovascular Anatomy and Physiology. Here you go, showing sitting and laying in a supine position. And you see how the blood pressure is working. So it says 90 millimeters Hg and 100 millimeters Hg, and 90 millimeters Hg when they're laying flat. But when they're sitting, it says 70 millimeters Hg, and then 20 centimeters in between, and 100 millimeters Hg, and then 70 centimeters in between, and 160 millimeters Hg. So you can see that right there. We're talking about the driving pressure. So it says figure 210, driving pressure, interrelationships, and effect of gravity on measured blood pressure. See text. Measured blood pressures are shown at the middle cerebral artery, aortic root, and dorsalis pedis artery in both the supine and sitting position. So good. So you can see here, clear again. I'll show it. We take our time. This is the place for peace where you can come on YouTube and just enjoy and breathe and read books by masters. I'm Master Uriel Riley. Thank you so much for being here. All right. This is a very key point. Thank you so much. Thank you. Awesome. I know I'm such a great reader. Thank you so much. Yeah, this is MCAT material. I'm a master fitness trainer. This is a masterful book, and we are reading here on YouTube to the people. Yes, this is super high level. Thank you so much for being here. Hi, is heart love. It must be kept clearly in mind that lateral wall pressures are not to be confused with driving pressures. In all of the examples just given, the driving pressures have dropped 10 millimeters Hg from the aortic root to either the middle cerebral or dorsalis pedis arteries. The measurement of lateral wall pressures is very much dependent upon gravity and the basilar reference point. However, Blood flow does not result from differences measured in lateral wall pressures, but rather from differences in driving pressures. When dealing with the measurements of blood pressure, we must keep in mind the differences between the measurements of lateral wall pressures and driving pressures. Lateral wall pressures are obtained in the classic fashion by occluding a vessel with an external pressure and gradually releasing it until the vessel pressure reasserts its dominance and flow is reestablished. To be meaningful, lateral wall pressures must be expressed in terms from a known reference point. Driving pressure has to do with the direction of the blood flow and refers to changes in total pressure energy. This includes the effects of gravitation and the kinetic energy, along with lateral wall pressures. Capillary blood flow. Welcome, YouTube. Peace, everyone. We read books and learn from masters on this corner of YouTube. Thank you so much. Capillary blood flow. For all those getting ready for the MCAT, this is the place to be where we are reading the clinical application of respiratory care. Thank you so much. Transmural pressure is defined as the difference between intraluminal pressure and the tissue pressure immediately surrounding the vessel. Transmural pressure is of academic interest in arteries and veins, but it is a vital importance in the microcirculatory system because the capillaries are permeable to many elements of blood, and there must be concern about the factors that maintain the vascular volume within the vascular space in these vessels. The arterioles represent the greatest area of resistance in the vascular system. Thus, a great drop in pressure is observed distal to the arterial system. This then allows us to assume that there would be a relatively low intraluminal pressure in the capillaries. This assumption is born out of the observation that the arterial side of the capillary bed demonstrates an intraluminal hydrostatic pressure of 30 to 35 millimeters Hg, whereas the venous side of the capillary bed demonstrates an intraluminal hydrostatic pressure of 15 to 20 mmHg. Thus, the driving pressure through the systemic capillary beds is approximately 15 to 20 millimeters Hg. These intraluminal pressures present in the capillaries are far in excess of normal tissue hydrostatic pressures. This fact raises an essential question that must be answered satisfactorily. What are the factors that maintain the vascular volume within the capillaries in spite of intracapillary pressures far exceeding the tissue pressures? Hydrostatic pressure tends to force blood contents from the capillaries into the tissues. There are three factors that play a role in countering the forces of hydrostatic pressure. 1. The blood osmotic pressure. 2. Capillary membrane stability. And 3. Tissue pressure in the systemic capillaries and alveolar pressure in the pulmonary capillaries. The microcirculation must have a means of regulating blood flow, since various tissues demand different degrees of perfusion at various times. This ability of the microcirculation to regulate blood flow is an extremely important mechanism, one that is consistently challenged in the critically ill patient. Figure 211 depicts a model unit in the capillary system showing the existence of arteriovenous or AV anastomosis. This is essentially a short circuiting device in which blood may flow directly from the arterial to the venous system without entering the microcirculation. This process is often referred to as peripheral arterial to venous shunting. The metatarterial, the metatarterial is a vessel with active sphincters having the capability of regulating blood flow through the capillary bed. A thoroughfare channel is the main capillary, and it is the basic path of blood flow when there is only a small or moderate need for flow through that particular tissue. When greater tissue perfusion is needed, the true capillaries are perfused by changes in the capillary sphincter tone. The regulation of blood through the microcirculatory system is an extremely complex process and incompletely understood at the present time. It's beautiful. What is understood is that it is basically a self regulating system that allows the essential exchange of nutrients and metabolites in the capillary bed while maintaining the essential relationship between vascular volume and vascular space. The self regulating system is termed microcirculatory vasomotion and is mediated primarily by blood components such as amines, polypeptides, and prototylytic enzymes and tissues metabolites. Venous blood flow. We are now at page 48. Here we go. This is figure 211. Thank you so much. I know it's a tough reading for all of you. It's not for everyone, just people that are trying to master themselves. That's what this book is for, mastering thyself. Clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout, the second edition. So, what you see here, it says the foundations of respiratory care, the precapillary sphincters, terminal arteriole, the arteriole, the AV or the anastomosis, the venule, the true capillaries, the postcapillary sphincters, and the metatarterial. It says Figure 211. Schematic representation of the vascular components involved in the regulation of blood flow through the systemic capillary beds, the microcirculation. See text for discussion. All right. Venus, blood flow. Peace, Marquise. Thank you so much. Highest heart love to my mods. Love you. Thank you so much, Marquise. Highest heart. You know I'm gonna keep going. You know it. This is for the MCAT for people, you know. I always come on here to give people master's point of view. You know, this is the master's corner of YouTube. So thank you so much for being one of my trusted and great mods. Keeping the chat clean. Highest heart love. This is big time. This information will allow people to be able to help so many others in their life, right? All right. Venous blood flow. The collecting portion of the vascular system is composed of capacitance vessels, i.e., vessels that can accept great changes in blood volume without extreme changes in lateral wall pressure. Venous blood flow to the heart from positions of the body or from portions of the body that lie above the heart is primarily accomplished by gravity. However, in the erect or sitting position, the majority of the arterial blood flow is to gravity dependent areas of the body. The venous system is capable of exerting a certain degree of venomotor tone, but venous blood flow to the heart from gravity dependent areas of the body is regulated by three factors. One, for all you taking notes and in the playlist. One, tissue pressures. Two, the venous valvular system. And three, body cavity pressures. Page 49. Thank you so much for the likes and subs. We are pushing toward 500. Thank you so much for choosing to read books with us here on YouTube, where we read from masters and learn how to master thyself. The venous return from the legs is primarily provided by extraluminal pressures of tissues, since the deep veins of the legs are surrounded by muscular structures. In addition, these veins have one-way valves, which do not allow retrograde flow. When these valves are competent, the muscular movements of the lower extremities provide a milking action, which forces blood toward the heart. If these valves become incompetent, they cause blood flow to stagnate and the veins to dilate. Such veins are called varicose veins. Ding! See us, that are master fitness, we don't have those, but we can understand it and we can help others understand it, right? You're looking at someone that's never had a surgery, but I've tore almost every ligament in my body. It's because I master myself. I heal myself, right? We are divinely made. The Most High gave us all the abilities. You have to give thanks. Be thankful. Upon entering the pelvic and abdominal region, venous blood flow depends primarily upon intra-abdominal pressures exceeding intrathoracic pressures. It should be obvious that in order for these mechanisms of venous return to the heart to act appropriately, there must be an adequate blood volume filling the venous vascular space. These factors of vascular volume to vascular space relationships and intra-abdominal to intrathoracic pressures are extremely significant factors in the field of respiratory care. It is extremely important to realize that 65 to 70% of the blood volume is contained within the venous systems. Thus, the arteries provide the resistance vessels and play a great role in the distribution of the blood flow. The capillaries are responsible for carrying out respiration itself. The venous systems contain the greatest portion of blood in the vascular system. The venous systems are extremely important and effective circulation. All right, and we're in the middle of page 49. Thank you so much. We're pushing towards 500 for the likes and subs on this channel, reading books. Oh, so masterful. I'm so proud of you and proud for us. You know, we do this together. Manifested a $3,500 book. Only master levels can read this. And that's why you're here, right? Have me read it to you. Thank you so much. All right. The blood. We're almost at the end of chapter 2. Yes. The blood. We have thus far considered the pump, core, and the vascular system, conduits. We must now consider the third element in the cardiovascular system, the blood content. Total body fluid is generally divided into two compartments, intracellular and extracellular. Extracellular fluid is, in turn, divided into 1. Interstitial fluid, fluid outside cells and outside the vascular system, and 2. Intravascular fluid, blood volume. The blood is defined as the body fluid that is contained within the vascular system. Approximately 13% of the total blood volume is contained in the heart. Ding! That is so key. Approximately 13% of the total blood volume is contained in the heart, spleen, liver, and other undefined reservoirs. The remaining portion of the total blood volume is contained within the vascular system itself. Of this vascular volume, approximately 30% is contained in the pulmonary circulation and 70% in the systemic circulation. In the adult, the blood volume is equal to 0.5.5 to 7.5% of the total body weight in kilograms. In other words, there is approximately 55 to 75 milliliters of blood per kilogram of normal body weight. This relationship is somewhat decreased in females and obese people. That's right. And increased in children and infants and muscular or thin people. The function of the blood is to transport vital nutrients to the tissues and to transport metabolic waste products away from the tissues. It is through the blood that the cells of the body are maintained in a milieu, allowing normal metabolic processes to proceed. In general, we may list some of the more important elements of transport, such as oxygen, carbon dioxide, carbohydrates, fats, and proteins. In addition, the blood is responsible for the transport of water, electrolytes, and metabolites, such as urea, nitrogen, and creatinines. The blood is composed of formed elements and liquid elements. These are commonly referred to as fractions of the blood. The formed elements are primarily cellular, e.g., the red blood cells and the white blood cells. The Hematocrit hematocrit is defined as the percentage of the blood that is occupied by cellular elements. If the cellular elements are removed, the remaining liquid is called plasma. Ding! If the blood is allowed to clot, the liquid portion that remains, aplasma. After the clot has formed, is called serum. Serum is essentially plasma from which fibrinogen, platelets, and other clotting components have been removed. Thank you. This is so good. Oh my good. The elements, the very intricacies of all these parts of blood are what help the circulatory system, as it's carrying the nutrients, it's helping the respiratory system. This is so masterful. Again, guys, this is getting us prepared for the MCAT if you want to take it. Oh, I'm so honored to be able to read this masterful information to you. Hi, it's Heart Love Coco. Peace. Awesome. Peace, Blue Goat. Gratitude. Coco Elotion. Salut. Bonjour. Thank you so much for being here. This is so good. When measured by weight, plasma is composed of 90% water, 7% plasma proteins, and 3% organic and inorganic substances. It contains cations, sodium, potassium, calcium, and magnesium, as well as as well as anions, which are chloride, bicarbonate, and phosphate. All these ions are important in the maintenance of cellular homeostasis and are referred to as electrolytes. There you go. There you go. All the talk all these years, now you know exactly what are the electrolytes. I'll read that again for you. Man, another dot connected. All of these ions are important in the maintenance of cellular homeostasis and are referred to as electrolytes. Plasma proteins are too large to pass freely through the permeable walls of capillaries and therefore are the main determinant of the colloid osmotic pressure. As discussed previously, this is the basic force that maintains the balance of water between the intravascular and the extravascular or the interstitial space. The proteins are composed of albumins, which have molecular weights of about 69,000 globulins, which are larger molecules. The fibrinogen, which is very large molecule, and lipoproteins. The primary agent for maintaining colloid osmotic pressure is the serum albumin. Total osmotic pressure, in distinction to colloid osmotic pressure, is a function not only of the plasma proteins but of electrolytes and other substances such as sugar and urea. The red blood cell is a the biconcave disc, which is just slightly smaller than the true capillary. It measures approximately 8.5 microns in length by 2 microns in width. It originates in the bone marrow and has an average lifespan of approximately 100 to 120 days. The red blood cell contains hemoglobin, which is principally responsible for the oxygen reserve in blood and one of the major buffering mechanisms for carbon dioxide and hydrogen ions. Thank you. We did it again. We have completed chapter 2 of application of respiratory care. You see, we completed it. Yes, we did it again. Clinical application of respiratory care. Chapter 2 is complete by Barry A. Shapiro and Ronald A. Harrison and Carole A. Trout. That's right, the abilities. That's what always matters. Oh, gracious and gratitude. Thank you so much, Coco. Thank you so much, Marquise. Highest heart love. We had a beautiful home going for our great aunt yesterday. Poured out a libation for her. I love you. I love you so much. Great Aunt Connie May. Aunt Connie Mays. Yeah, we have greatness all around us. Our family does. It's just the way it is. You know, we've all, I mean, nothing but greatness. She was an original healer. Aunt Connie Mays was a nurse. She knew this information. A master nurse. She first became a nurse, a licensed practitioner, LPN, in 1955. She was born in 1928. I love you so much, Aunt Connie Mays. Bennett Mays. Highest heart love. Thank you so much for reading this with us. We did it again. We just completed another chapter. Next, we're on to this third chapter. Shaking it up in the world, reading masterful information. We have the ability to heal ourselves. That's what this channel is about. Masters are going to be mastering. Thank you so much for being here. How's it feel? It's the 3rd of August. Yes, we made it. It's the 3rd of August. We did it. Love you. Right? Awesome. I'm wishing all wellness and greatness for all of you. We have a great day. It's the first day of the week. So start it off right. Giving honor and thanks. I love you so much. Have a wonderful day. All right. We will be back with chapter 3 soon. Thank you so much for being here. Thank you to all my mods. Yeah, thank you, Marquise. Happy 4 month. That's right. Oh, woo, getting up there, right? People don't be believing how old I am. Like, wow. We got to keep our self right, you know, and speaking life into others and speaking love and light into the world around us and cultivating this is part of how we love ourselves, honor ourselves, and where we came from. So that's how we got to do it, right? We have to do it. It's all up to us. I love you. I love you so much. Thank you for being so honorable. I will see you soon, right? We are mastering ourselves. Have a wonderful day. Peace. Thank you so much for sharing in life.